If health matters to you, ask the doc. Tell me what you see. Health Matters with Dr. John Darcy.
Katie, to sleep, perchance to dream.
And sleep's pretty important, isn't it, Doc?
It sure is important. Apart from feeling lousy the next day if you've had a bad night's sleep and making you irritable, there are some serious consequences of poor sleep, like whacking on weight, like getting type 2 diabetes, and even an increased incidence of coronary heart disease.
Wow, that's all pretty worrying stuff. And someone who knows the reality of it pretty well is Rod Gonfire, who he used to fall asleep at traffic lights, Doc, and his snoring got so bad that he had to leave the room. He couldn't sleep in the same room as his wife.
I know a lot of people who are just like Rod, and he joins us on the line. G'day, Rod.
Hello there, how are you, mate?
Listen, mate, falling asleep in the car, it's quite common with sleep apnea, is it not?
Yes, that's right. Yes, no, I do suffer from sleep apnea. The sleep test that I had showed that I had a obstruction to my breathing, which caused an apnea interruption.
So that means
74 occasions an hour.
Oh, wow. What effect did it have on your life?
Well, the major thing was the snoring to start off with. I've been battling with that for about 10 or 11 years and tried many, many different devices, but certainly the other part was just feeling drowsy during the day, quite dozy at my desk, sort of nodding off in embarrassing situations in meetings, and certainly not very safe if I was behind the wheel of the car at times.
So, Rod, you say, you were snoring for 10 or 11 years. What ultimately prompted you to get medical help?
Well, I guess frustration more from the interruption to my wife sleeping was the major trigger. I have a brother-in-law who uses a CPAP pump, constant pressure pump, and I started from there.
Now, why didn't you stick with a positive pressure pump, the CPAP pump? Because now you've got a different device that's helped you, and we need to know more about that.
Well, I've never used a CPAP pump.
Oh, haven't you?
No. I went to CPAP Australia, which is a company which market a particular product. It's called Provent. And
this is this new thing, this new Provent.
That's right. It's a product that I'm not quite sure how long it's been available in America, but certainly it's not been here, I think, for more than around 12 months, I was told. And I was given the opportunity to try it out, and that was about September last year, so 9 or 10 months ago.
So 9 or 10 months ago, and how has life changed since?
It's been excellent. Very rarely does my wife have to elbow me or turn me over because of snoring. She's quite a light sleeper, and so that's helped our relationship as well. That if she has a bad night, it's normally because of her, not because of me. And then, of course, just feeling a lot fresher each day, and certainly not falling asleep at my desk or getting drowsy in meetings or behind the wheel. It's been great.
Listen, Rod, thanks very much for joining us on Health Matters. You ain't alone, mate, and I can tell you, not me, of course, but there's a lot of my colleagues who do snore, and both men and women, and it's a real issue. So thank you very much for telling us about this new device, and we're going to find out all about it in just a moment. So thank you very much.
Thanks, Rod.
You're welcome.
For more information about the EPAP device, talk to your general practitioner.
Coming up, how to get the gift of sleep. 4TO.